Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about the potential for having pain in the opposite knee or the non-surgical knee as you rehab and recover from your knee replacement surgery. So the first thing I want to say is this is normal and prevalent after knee replacement surgery to have some pain and discomfort in the non-surgical knee and leg. And the reason for this is most likely you have arthritis in your non-surgical leg as well. You want to think about there's the same risk factors, the same processes are occurring probably on both sides. The activities that you've done throughout your life, the increased weight bearing, if you might be overweight or have other risk factors, those risk factors are going to play a role both in the leg you have surgery on and the other leg as well. Probably one thing that might not be similar is if you were to have a particular injury or a history of having an injury in one leg compared to the other, that might be a little bit different. But you want to think that overall, there's a lot of similar risk factors and chance of developing arthritis in not just one knee, but potentially both. Also, as you're rehabbing and recovering from your knee replacement surgery, you're going to be putting a lot of stress through that non-surgical leg, especially early on when the surgical side is painful and swollen and sensitive and can't really tolerate as much activity. When you're walking, when you're doing things, just unconsciously, you're probably going to put a little more stress, a little more load through that non-surgical leg. So you're increasing the stresses and forces through that leg. And then as you rehab and recover from your surgery, you're going to start to move differently than you did before surgery. You're going to have different range of motions, different levels of strength, and you're just going to be walking and moving a little differently, and that's going to change the stresses that are going through your knee, as well as the stresses through other parts of your body, your hips, your low back, and throughout. So for these reasons, it is common and normal to have some increased pain and discomfort in your non-surgical leg, non-surgical knee after having surgery. So what can we do about this? Well, before we do, I want to make sure that you click that subscribe button below if you are interested in anything videos related to knee replacement surgery, exercises, rehab, recovery, frequently asked questions, and everything else in between. And turn on those notifications so you never miss a video. I post videos every other day. So what can we do to manage and deal with this increased pain on the non-surgical side? Well, part of it is just accepting it, and I like to say kind of grin and bear it. Now, I don't mean this absolutely. I mean this up to a point. Up to a point, just it's kind of the nature of the beast. You're going to have some pain, some discomfort. As you get stronger, as you heal and recover, as the inflammation and swelling throughout your body decreases, you'll hopefully have less pain and less discomfort on both your surgical leg and your non-surgical knee. So part of it is just you got to work through it. Now, some other things are you want to think about when you're performing your exercises, so your range of motion exercises, your strengthening exercises. Make sure you're addressing both sides. If you're doing flexion and bending range of motion on the surgical leg, go ahead and do that same thing on the non-surgical leg. If you're doing a quad set or a strengthening exercise on one side, go ahead and do that on the other. Something that's, of course, very intuitive and makes sense is that many of the exercises that you do as part of managing knee pain and knee arthritis are extremely similar, if not exactly the same, as a lot of the exercises that you're doing after knee replacement surgery. So doing the exercises on both sides is really great. And if you are planning to have a knee replacement on the opposite leg or are considering it, then doing the exercises already is starting you on the track to doing those prehab exercises and having a good outcome if you do end up having surgery on the other leg as well. So what else we can possibly do is if the pain is so intolerable and so difficult with exercises and land-based activities, then think about some alternatives. Think about some alternative exercises that are low load, low stress through the knees and the legs. So of course, probably the best example is aquatic therapy. Pool exercises are absolutely great. Decreases that load, decreases that strain through your knees, through your legs, and a lot of people end up tolerating it a lot better, and there's tremendous benefits. Some other things may be cycling. Is also a great option as well. But try to find those exercises that you can tolerate and that you can do consistently to build up that strength and hopefully build up that tolerance with other activities. Now, if the pain is really unbearable, there may have to be some active steps taken to control that pain and manage it so that you can tolerate your recovery after surgery. So an example of this could be having a cortisone injection into the non-surgical leg. Provide some temporary relief, hopefully, for a few weeks to a few months, and at least just gives you that relief that you can tolerate your exercises and activity after surgery. And also, of course, effective use of pain management and multimodal, so multi-different modes of pain management, both on the surgical leg and the non-surgical leg, can be very helpful and very beneficial in allowing you to tolerate your physical therapy, your rehab, your recovery afterwards. So I hope this helped give you some helpful insights. If nothing else, let you know that it is perfectly normal and very common to have some pain and discomfort on the non-surgical leg. If you found this useful, I appreciate your likes. Please leave your questions and comments below. And again, be sure to click that subscribe button and turn on notifications so you can catch all of our latest videos. Thank you very much for watching.